Good afternoon. It is a great pleasure to conduct this interview with Associate Professor Anchali Krisanachinda from Thailand, who is the Professor Inamura Orator for 2022. Professor Anchali is a very well-established and well-known medical physicist in the Thailand and AFOMP region. She graduated her first degree in physics with honors from Chulalongkorn University, majoring in nuclear physics, but she also studied radiation physics at the University of London and trained at the Royal Marsden Hospital, UK. She has had many achievements, but I will highlight just a few. She, with the support of WHO, established the first medical physics graduate program in Thailand, and currently there are 6 programs like this in the nation. In 2002, she established the Thai Medical Physics Society that currently has around 400 members. She was elected its first president. In 2007, she established medical physics clinical training for radiation oncology, diagnostic radiology, and nuclear medicine medical physicists in Thailand, and she invites medical physicists from Myanmar, Vietnam, Sri Lanka, and Nepal. She was one of the founding members of Asia-Oceania Federation of Organization for Medical Physics, as well as the Southeast Asian Federation of Organizations for Medical Physics, and was serving in the past as a CFON president and AFOMP treasurer. In regards to International Organization of Medical Physics, she served as a chair of Education and Training Committee, as well as IOMP treasurer for 2 periods. She is also the leader of data collection for United Organization Committee UNSCEAR to collect clinical DRLs in Thailand and Southeast Asian region. Professor Anchali, it is a great pleasure to have you here at this interview. And if I may, I would like to ask a couple of questions about your fantastic contribution to the medical physics profession in the AFOMP region. So may I please start? Can you tell us a bit about yourself? How did you become a medical physicist? And what do you enjoy most about being a medical physicist?
Okay. Thank you very much for your question. It is very nice to be at this interview. So you have already mentioned about my life. It's nearly everything, but there are something I'm pleased to mention. It was after my graduation of the Bachelor of Science in physics that I received a second-class honor. And there is a need of a hospital physicist at that time to work in radiotherapy and nuclear medicine, especially at the university hospital. So it was posted at my university. So I found it, and I think that, oh, it is very interesting to have a work in the hospital. So I applied for the work. And at that time, the university hospital is still under construction. So I have to train at the other hospital in the field of radiotherapy and nuclear medicine physics. Mm-hmm. And from that time, we are very lucky that we received the support from the World Health Organization and from IAEA to send a medical physics expert to our country and teach us about all of our medical physics work in virtual, on site. So I learned many things from the expert from England and also from Australia, coming to our center, and we learned everything, including radiation safety, medical physics, and radiation dosimetry, dose measurement or calculation. So at that time, we have to work both radiotherapy and also nuclear medicine at the beginning. But I think the expert mentioned about attend continuing education. So I applied for the International Atomic Energy Agency fellowship and get the fellowship to study in England, as you earlier mentioned. And it took me about 2 years to learn what is medical physics work and how is the research for the medical physicists. And at that time, I remember that I have perform the research using the phantom. It is a brain phantom, and it is something about lesion detectability in the brain phantom. It is very interesting me about, oh, I don't need to have a patient, but I can use the phantom from the Royal Marsden Hospital, that they have a lot of phantoms, a lot of equipment. So it is a good opportunity to not only attend the classes, clinical practice, but also follow the research by the key person at the Royal Marsden Hospital. And then when I come back, I think that I did not want other Thai people struggle like me to study in England. The weather is very cold and it changes most of the time. Sometimes it's raining and the food is very strange compared to Thai food.
Yes.
So I think I should have a medical physics education program in Thailand. So I discussed with my boss and we start propose the medical physics program to the university. And I also got lucky because received expert coming to the department to help starting the program with the teaching. So that was around in the year 1970 something, not a very long time ago. And we start one by one and have a more number of medical physicists, mostly in radiotherapy and nuclear medicine. We didn't have medical imaging at that time, okay? And then those who finish from this program, they also start another program and at their hometown, like in Chiang Mai and in other provinces. So one by one, and finally we have altogether 6 programs in the country.
That's amazing.
But the number is not enough because we cannot have more medical physicists per class. It depends on the number of research and also medical physicists who is a supervisor. So we have probably about 10 to 20 medical physicists graduate per year. And sometimes very few, like 1 or 2 per institution.
Yes.
So the number is not enough. So we have to have more centers in medical physics. This is my thought. And the number of centers should be at every part of the country in order to have enough medical physicists working at the cancer center, because the cancer center is increasing very rapidly at all parts of Thailand. So this is one of my parts that I involve in education of medical physics. Yes.
And what do you like most working as a medical physicist?
What I like most is I'm lucky that I get together with those alumni. So those who graduate from this program and that program, so we get together so we can have like a medical physics club of Thailand at the beginning.
Very good.
Yeah, so we met like every other month and we exchange information. What is the trouble? What is the problem in medical physics life? So this is a good time that we can learn from each other about the experience from this center and other center. And furthermore, our country is a good country, so we have many experts come to Thailand to visit many times. Yes, and they probably enjoy Thai hospitality, so they keep on coming and help us. Even Professor Slavik Tabakov, he also come to our country and help about our curriculum to make it in a good shape. Yes, so this is I'm very happy very much in order to get the support from each other country. And this is the first thing that I think that I should not only receive, and we should not only receive, but we should contribute to our neighbors. Our neighbors mostly have no education, have no clinical training. So we have to support them. The other country in the region like Myanmar, Laos, Cambodia, and Vietnam, and sometimes Malaysia, that they lack of some branch of medical physics. So this is my goal, that we should open the program in international or for the region to support those countries. And I'm very happy to help the people. So our people no need to go to England. Our people no need to go to Australia, except they would like to continue education in the doctoral program.
Yes. Yes.
Okay.
Oh, that's
So,
fantastic.
yeah.
And I'm so glad to see that you are not only thinking about Thailand, but also about the surrounding nations.
Yes,
So that
right.
other countries have access to
Yeah.
medical physics training.
Yes.
Do you have enough medical physicists in Thailand? What is
No,
the situation?
still not.
Still
Still
no.
not, because some medical physicists, they enjoy to be application specialists
Yes.
because they know very well about the products.
Yes.
Use the product very well, and working as an application is challenging for them. They can
Mhm.
meet many people and they can exchange information, train other people. So the majority of medical physicists go to the product company.
To the companies
Yeah,
themselves.
to the
Yeah.
company
Yeah.
and earn more money, something like
Oh,
that.
that's the problem. Yes.
But I still keep on at the education because I'm very happy to teach the people, especially in medical physics, and train them. And when they have a problem, they can come back to school and we can exchange information. The number is not enough, but it's increasing compared to other
Fantastic.
countries.
Excellent.
Yes.
What would you consider the hardest decision
Mm.
you had to ever make?
My family life, I have no problem. I'm very happy with the family life. But administration is difficult because in the department, it is like a multidisciplinary profession. We have to work with radiation oncologists. We have to work with radiologists, as well as nuclear medicine clinician, technologists, nurses. So sometimes they think different from us. My idea is would like to help the people, would like to start education, continue education. But other profession, they better care about clinical work. They thought that the number of medical physicists, it is not enough. And at that time, we did not have much software. We did not have backup. So we have to do real calculation. We have to do one by one calculation, planning or something like that. So they would like us only doing something for the clinical practice, not involved in the education. So that's difficult for me. Yeah. So if we have more medical physicists to supply in the position, different position, so it will be good. But if the school was stopped, so it will be in difficulty to have more medical physicists. So this is the hardest time in my life, that they would like to stop education and continue only clinical training, clinical practice. Yeah.
But you have to still manage both.
At that time, I am in difficulty, and then I resign. Okay, and go to other university that they understand me, and they allow me to continue education for other young medical physicists, so I can establish another program at other university. So my life is more happy. Yes.
That's fantastic. And I agree with you. And I think many physicists will agree with you that sometimes dealing with administration and bureaucracy gives us lots of headache.
Yeah.
What
And
what would you consider your biggest achievement?
Well, as I mentioned to you, that I am the person who received support from many organizations, many countries. So I should give something to other people. So I try to help our neighbors most of the time, helping Myanmar. They are in difficulties in their country. So they come to Thailand in order to need the support. And also not only for the education training, but their lives, sometimes they have to be in Thailand for a while. and help the Lao patient, no, not Lao patient, Lao physicists. They did not have one medical physicist, so we have to establish the first Lao medical physicist in radiation oncology in Cambodia and in Vietnam.
Mhm.
So this is a part that I think that I have done a lot for them.
Yes, yes.
And
Oh,
even
that's
though the outcome
fantastic.
is not so good, because when they go back to their country, they did not have everything like in our country.
Yes.
So they have to step by step improving their country, but we always support them. So this is something achieved me, that I can help our neighbors to be more uniform in the medical physics education and clinical training in the region.
You are very selfless. Thank you for
Yes.
that.
Uh-huh.
What advice would you give to young people today who want to become a medical physicist?
Well, I think those who come to this program, they love physics,
Mhm.
they love mathematics, and they love working with the patient. So I always encourage them to continue and behave like the old generation, that we work like in the family life, that start from the senior one who train the junior one. So this is the system that we have training of a medical physicist in the department by supervision before we have a clinical practice from IEA. So what I advise to them is they have to get together and also learn about new technology. And after I have settled my society, so we have an opportunity to meet like every 2 or 3 months or every year, so we can exchange information by the annual meeting at the society. So we have tried many things for the member of the society. For example, we have a national medical physics license. So this is something that I'm very happy to tell
Yeah,
everyone, that this is a good standard of medical
absolutely.
physics. Yeah,
That's
right.
fantastic.
Yeah, because we
Yeah.
get the license, they come to establish our program.
Mhm.
Every program, and is it a good program to get the member of a license? So after they approve the program and approve the curriculum, so they have a structure of how to get the license, give the license to medical physics. Because other profession like a medical doctor and radiological technologists, they also have their own license.
Licenses, yes.
Yeah, right. And Ministry of Public Health, they assign that if you set up the cancer center with our medical physicists, so it is not allowed to function. So
Okay.
it is like a compulsory that,
Yes. Oh, that's excellent.
yes.
Yes,
So
that's excellent.
without medical physicists, no radiation oncology department.
Can
Okay.
function.
Except we can invite external medical physicists to be
Yeah.
a part-time. That is
Yes,
one
that's possible.
solution. Yes.
Yeah.
Yes.
Considering how medical physics is evolving, we see, rise in particle therapy, artificial intelligence. Where do you see medical physics profession to be in 10, 20, or even 30 years?
Well, at the moment, we have a lot of artificial intelligence involved in our work and in education. So even in radiotherapy or in nuclear medicine, there is a software that AI involved. So we assign research for the students and residents to do the AI. For example, one student do the breast lesion detectability using AI, okay, CNN, something like that,
Yes.
for classify and characterize the type of the cancer from microcalcification, from benign or from normal. So this is already in the research in the medical physics program for both Master of Science and also in the doctoral program.
Oh, fantastic.
So AI is already involved in our life, and in the future, like for in the 10 years in the future, I believe that AI is something that everyone will use it for the accuracy, specificity, or sensitivity in the diagnosis and also in the treatment of the patient. And we have an opportunity to use like something like modeling, yes, the kinetic modeling in nuclear medicine, patient-specific treatment. So each patient will receive particular dose according to the lesion of the cancer. And we also have a proton therapy. It is the first proton therapy in Southeast Asia. And it's about 2 years that we settled the proton therapy, and the treatment is going on quite well. And we receive the support from other countries, like from the United States, from the Japan, and also those who already have proton therapy to help us about the research, exchange research, and use of the proton therapy in the right way. So in the future, I think some other radiotherapy center can have particle therapy, I guess. Yes, because probably proton is not exist. So we have to change to particle therapy and other kind of radiotherapy, which is a benefit to the patient. So this is probably in the next, not 10 to 20 years, probably in the 5 years.
5 years, yes.
It will be advanced technology, and we should be cover all of that technology in very soon.
Yes, yeah. Fantastic. Professor Anchali, what is your life motto? What is your credo every morning that you wake up and you still go to work to teach and perform clinical work?
I am very much in love with medical physics. Okay, so it's my passion about medical physics, and I encourage young students, their future after graduation, they must be a good medical physicist, try to help the people, the patients, the cancer patient, and other people around them. So I will be their idol, so they can see me and they can follow my steps. So that's why I become a president of Thai Medical Physicists for 20 years. Until now, and nobody would like to take over my position. So I think that they follow my step and doing many things to be good to everyone and a good medical physicist in Thailand. Yes, so this is my motto, is sustainable and be medical physicist, good medical physicist in the country and help other neighbors. Yes.
Professor Anchali, you are a wonderful role model who has left an incredible legacy, not only in Thailand, but also in Asia, Oceania region, within all our countries. I congratulate you on your Professor Inamura oration for 2022. And it has been a pleasure talking with you. And thank you very much for your time today.
Yeah, thank you very much, Eva. It is my good time to express something from my heart to you and other medical physicists in our region and in the world, to know that Thai people are very kind, very generous, and we enjoy giving hospitality to the patients and everyone in the world. Yeah, thank you.
Thank you so much.
Thank you.